Alberta Health Services has travelled well along the path to make a difference in health outcomes for Indigenous peoples in Alberta. We've adopted the Truth and Reconciliation calls to action, made Indigenous awareness and sensitivity training mandatory, and we've created an Indigenous health strategy. But we have a long way to go before we eliminate disparities in health outcomes between Indigenous peoples and mainstream Albertans. This is especially true when it comes to diabetes, where almost 15% of First Nations peoples in Alberta have diabetes, compared to only 7% for non-First Nation Albertans. Lower limb amputations and kidney dialysis rates are 3 times higher. And, alarmingly, determinants of health such as poverty, barriers to access health care, inferior food supply, and lack of clean running water often result in earlier onset of diabetes and a quicker progression to severe health outcomes. But beyond statistics, we hear stories such as, it's one thing to have one's heart broken, it's another to have it broken wide open, as in when I see the people in my community die from diabetes complications. And from an elder we heard, when I lost my limb to diabetes complications, I lost my spirit as well. Our project is intended to create harmony in diabetes care with Indigenous communities. By establishing trusting relationships in communities with high diabetes prevalence, we will jointly braid together evidence-based diabetes care with culturally relevant practices that are both traditional and non-traditional, and that focus on addressing the role of the determinants of health. The braid will also include the healing factors that already exist within the community and in the person living with diabetes. The braiding or co-design will be collaboratively done, including groups such as our SON operations, SCNs, the Provincial Indigenous Health Network Hub, as well as primary care, First Nations Inuit Health Branch, Métis Nation of Alberta, and university partners. We intend to develop 3 bundles with rural and urban Indigenous communities. Bundles are sacred and can represent healing and protection, and can serve as a guide to live a healthy life. These 3 bundles are a community bundle that will include the beliefs, the traditions, the knowledge, and the tools available in the community. The personal bundle is specific for the individual and is intended to support that person live a good life with diabetes. A care bundle will be founded in evidence-based diabetes care and practices. Ultimately, we'll be creating harmony in diabetes care in the community, within the healthcare system, and for the individuals.